Welcome to the MamasteFit Podcast Birth Story Friday. In this episode, we have Alyssa, who is going to be sharing her hospital induction birth story where she went unmedicated, but she really shares a lot about her postpartum experience as well, where she dealt with some complications that she was not expecting. Welcome to the MamasteFit Podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit Podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We're glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit Podcast Birth Story Friday. In this birth story, we have Alyssa here who is going to be sharing her hospital induction birth story where she actually went unmedicated. And I know that's a story that a lot of folks are really looking to hear about because induction can be really scary. So thank you so much, Alyssa, for being here.
Thank you for having me. I'm very excited.
So let's start with how you prepared for birth. So what were you doing throughout your pregnancy to prepare for your birth?
Right. So from the moment that I found out I was pregnant, even before I was pregnant, I was like, okay, I'm going to prepare for this like anything else that I've prepared for in my life. I'm just going to dive straight in. And so I tried to utilize as many resources as I could. I feel like I mainly prepared for birth by podcasts and audiobooks. I have a commute to work, and so I probably listen to almost every book on birth out there. My husband jokes that I have like a PhD in labor and delivery when I do not. But I
have a PhD in Google, right. So I think yours is better.
And so I just dove straight into books and podcasts, and I started finding out about you guys being local to the area. Found out about MamasteFit and the birth prep courses, and just the inspiration to move. I've always been into exercise, but I didn't know what that looked like in pregnancy. So it was really awesome to find a resource that showed me like you can continue to lift heavy. You do have to make some types of modifications, but you can continue to work out and actually like continue to build muscle and be strong throughout your pregnancy. So I definitely say, you guys helped me prepare a lot just via your birth stories, your podcasts. I'm pretty sure I've listened to almost every single one, which is maybe a little creepy, but I learned so much from you guys. And just following the prenatal programming was amazing. I took your guys' birth prep class. I hired a doula. I did a lot to prep for birth.
So let's talk about the end of your pregnancy then. So what was the end of your pregnancy like? And we can just go straight into your birth story.
Okay, sounds good. So the end of my pregnancy, around like 38 and a half weeks, things started to feel a little different. I noticed more Braxton Hicks type symptoms, but nothing really happened. So many of my friends had gone into labor early. So I was, per the first time mom code, delusional, that I would also go into labor early. Like I quit work early, all of these things. So yeah, the end went great. I mean, the end was fine. I really wasn't uncomfortable. I wasn't uncomfortable throughout my entire pregnancy, which was great. I was doing well. But yeah, I thought that I was, going to go early like everyone else. I did not. So end of my pregnancy, I started doing everything in the book besides castor oil. Anything you can name, I did it. Chiropractor, massage, dates, tea. I mean, everything. At my 40-week appointment, which was when I was at 40 and 2, I had a little bit of a high blood pressure reading. There's nothing crazy. It was like 135 over something. Wasn't anything crazy, but they wanted me to come into labor and delivery the next day, which was a Saturday, to check it out and do a non-stress test on baby. At that point in time, I accepted a cervical exam just to kind of see what I was walking into. And I was 1 centimeter dilated and 50% effaced. So Saturday, I went into labor and delivery, had another elevated blood pressure reading, nothing crazy, no protein in my urine or anything. But whenever they did the non-stress test, they noticed some random decelerations in BB's heart rate. Um, who knows if the random decels were normal or, everything was still progressing normally, but we didn't know if it was a sense of urgency or not, but we just decided to stay for an induction just because we didn't know what was going on with her. So we decided to stay for an induction. So I went into labor and delivery on Saturday and did not leave. So yeah, I guess into the induction and the birth story. So um we decided we weren't going to leave. This was kind of Saturday afternoon. I spoke with the midwife that was on staff, who was actually who I saw during my 40-week appointment. And me being in the military, that was one of the harder things, is because I can't really like interview providers or anything like that. Like who you get is who you get. And that's another reason why I was so adamant in hiring a doula, because I really wanted somebody like a constant there for me. So the midwife that was there at the time did a really good membrane sweep on me at around 4:30 on Saturday, and we decided to start with Cervidil. So that's a 12-hour thing, of course. So we started that Saturday night. Once that was placed, my husband went home, got our bags, got the dog to boarding, all of those things. At that point in time, I was 2 centimeters, 70% and -2 station. I started having like some irregular, stronger contractions where I was uncomfortable. It wasn't anything crazy, but it was affecting me trying to go to bed. So I got some IV Benadryl, which was really great. I think I was asleep before the nurse left the room. Um, so that was great. Um, the next morning, so Sunday morning, Cervidil came out. I was still 2 centimeters and -2, but I was 80% effaced, so a little bit more. I was trying to do everything in my power to avoid Pitocin. I really wanted just like natural labor contractions to happen. I really didn't want Pitocin. I was a little nervous about the Pitocin contractions. So I really wanted to do everything. So we decided to go forward with a Foley balloon, and that was put in at 9:30 on Sunday. The contractions definitely intensified. They were like pretty strong every 45 minutes. I was on the ball. I would turn on like birth affirmations on my headphones when a contraction would hit and just breathe through it, and then turn off the affirmations and go back to watching TV, that type of thing. And they were very intense for a while. And then as I dilated and there was less pressure from the Foley balloon, or bulb, what have you, they definitely died off. They started dying off, and I was like, oh no, here we go. They're dying off again. So that afternoon, they asked if I wanted to use a breast pump. I said, yes, I'll try it. Tried that. Might have helped. Nothing consistent. They definitely started waning. So my doula showed up that afternoon and asked if we could maybe do some positional changes before starting Pitocin. It was great, but those monitors were like the bane of my existence. I hate those monitors, even though they were wireless. Like I was like going into birth, I was like, oh, perfect. They have wireless, waterproof monitors. I'm set. Wrong. They kept having to reposition them. Like I would get into a certain position. They'd be like, oh, baby doesn't like that. Baby doesn't like that. You need to move. And it was just a whole thing. So it was very annoying, very irritating, just because I also just wanted to go into labor on my own. And it wasn't happening. So nothing really happened. Foley did fall out around 3:30. We tried to do some more positional changes, but nothing just wasn't working. So we started Pitocin around 5 p.m. and active labor really started getting going around 7:30 on Sunday night. The TENS unit was my best friend in the whole wide world. The surge button on it was great to help get me through it. I also gaslit myself, as you guys have talked about, into like telling myself that contractions. I told myself like, it's only like 15 or 20 seconds of pain. Like I can do this.
It's a good technique.
It worked. I completely gaslit myself. I was like, I only need the surge button for 10 seconds. um, completely gaslit myself. Oops. But it worked. Around like 9 p.m., I looked at my doula and my husband and I said, I want an epidural. And me and my doula talked about this beforehand, and she told me, at some point you will probably ask for one. So what do you want me to do? Do you want me to go get the anesthesiologist, or do you want me to help you move into a different position? And I told her pre-labor, get me into a different position. I want to keep going. So we tried the shower. The only problem with this is that the monitors wouldn't stay on in the shower. So a very annoyed nurse was like halfway in the shower with me trying to keep the monitors on. She's not pleased. I wouldn't be either if I were in her situation. So my husband put on his swim trunks and tried to get in the shower.
Swim trunks.
Tried to get in the shower with me to hold the monitors on. It just wasn't working. I was getting so fed up. So I just got out. I mean, I said I was just so annoyed. Everyone was annoyed in that situation. I really wanted to utilize the shower, but alas. So I gave up. I got on the toilet for a while and there was some leaking, like super intense contractions. This was around like 10 o'clock, super intense contractions. And I guess I was making the sounds kind of like I was bearing down. So the midwife ran in. And she checked me. I was around 7 centimeters, 100% zero station. So I was feeling pretty good at that point. Everything was really intense, but I just kept telling myself like, well, you can't back out now. Like there's, the show is already on the road. You cannot back out now. And it was very interesting through every contraction. Every time a contraction would hit, I would be listening to my birth affirmations, trying to repeat them and pressing the surge button. But in the back of my head, the little piece of doubt was like, what are you doing? You are an idiot. Like, this is so silly of you. And then after every contraction ended, it was this like burst of like, I'm amazing. Like, this is so cool. Like, I'm doing this. I'm going to do this. It was, my emotions were a gigantic wave the entire time. As I guess
it's like having multiple personalities.
Absolutely. Absolutely. It really was like in a contraction. I was like, what am I doing? Like this is hard. Like this is really hard work. And my husband was trying to bring up, hard things that I've done in my life. Like, oh, honey, you did this. And I just told him to shut up. Like I don't want to hear it.
Stop talking to me.
Stop talking. My doula tried to put some essential oils on my face. I think I was like, no. She goes, what's that? Like, so many things. I was definitely in the labor land. That's for sure. I had no concept of time. But yeah, so around 10:30, from 10:15, I was around 7 centimeters, and around 10:30, there was some leaking or something. I don't know if it was amniotic fluid, mucus plug. I have no idea, but it was very intense. I was still on the toilet. Midwife checked me and I was complete. So I went from 7 to complete in apparently 15 to 20 minutes. It seemed like a lot longer to me, but this is according to my husband's notes. So
time is magic during labor.
Yeah. So it took me a while to get there, but we got there. So once we figured out that I was complete, we were like, okay, time to push. And I pushed for 3 hours in many, many different positions, which was one of my main goals in going unmedicated. Was I wanted to be able to move. I wanted to be able to move around and to feel free. And I did that, which was really great. But I squatted at the end of the bed, and all fours. I did tug of war with the Rebozo band on the squat bar. Every position, I probably did it. And time just moved around a lot. Hip squeezes the entire time. My husband is a champ. So yeah, I pushed in almost every single position for 3 hours, and she was born at 2 a.m. on Monday. So it was a long process, but we got there. She was there. It was amazing. We immediate skin to skin, the whole thing. It was really amazing. Like pushing her out was very gratifying, even though it was like 3 hours long. It felt like I wasn't making any progress. But when she finally was out, it was like, oh my gosh, like this is why I did this. Like I know now. Um, yeah, so she was warm. We got a little bit over an hour of skin to skin. The placenta was delivered about 30 minutes afterward. My midwife tugged on the cord a little bit. Um, we got, like I said, a little over an hour of skin to skin before I started noticing some pretty intense cramps. A nurse that was there was like, "It's normal, no big deal." But I just really wasn't feeling great, and my doula actually noticed that I was going pale. Like color was
Oh,
draining
no.
from my skin. And so she
Oh, gosh.
advocated, yeah, so she advocated for the midwife to come check me again. And it turns out I was hemorrhaging. Um,
Oh, excellent.
yes. So my midwife got her hand all up in there and started just like pulling out giant clots. Super uncomfortable. Like that was more painful than labor and delivery. Just like all the clots coming out. I was like screaming in pain. My husband was perfectly fine throughout all labor and delivery, but when he saw all that blood, he had to step out of the room. I didn't know that he stepped out. I didn't know how much blood was coming out, but apparently it was a lot. So that was
Yeah.
super fun. And then an added bonus, I started having some really intense rectal pressure, and I was so confused. I was like, am I still hemorrhaging? Like, what's going on? Like, I have this, like, it felt like I was trying to poop, but I was like, there's nothing going, like, I'm so confused, just really intense rectal pressure. So they did another exam and revealed that I was developing a vaginal hematoma. Um, so they tried to suck it out with some type of machine, but that was so painful. I couldn't stand it. They were trying to get pain meds on board. It was, at 3 a.m. That was super painful. They tried to place some gauze up there to like help soak up the blood. We don't know if that helped. They put ice in gloves, like in sterile gloves, and put that up there to try to slow the bleeding. Um, it was a whole ordeal, and I didn't really know what was going on. Everyone, I mean, me and my husband are exhausted. Um, Eventually, when I was stable, we got a CT. I wasn't actively bleeding from the hematoma anymore, which was good. But we got the CT around 10 a.m., so that's how long it took me to get kind of stable. And it was around 11 by 6 centimeters, which is the biggest hematoma my midwife had said she'd ever seen. So
Yeah.
Look at you, number
like,
one.
go me. Yeah, I know. I was like,
Not the number one you wanted, though.
no. I was like, really? Okay, the biggest one you've seen. Awesome.
Like, was that
Awesome.
necessary to tell me?
Yeah. I was like, great. Woohoo. So that explains why I was having so much pressure because it was on like the posterior aspect of my vaginal wall. Um, so that was just a wild ride. I'm really happy that I had expressed colostrum and brought it to the hospital because there were, it hours where there was no way I could have tried to nurse her. She latched on a little bit during our initial skin to skin, but then, I didn't hold her again for probably another 5 hours. It was so luckily I brought that with me. So my doula showed my husband kind of how to feed that to her. So I was really happy that we brought that. Um, but yeah, so once I was stable, we got the CT around 10 a.m. on Monday. And then around 4 p.m., they assessed me again. I was able to stand and walk around, which is progress that they didn't think they were going to see. So they gave us the okay to move to the mother baby area. So, and I was hooked up to a whole bunch of pain pumps and all the fun things, had to have Foley put in. All the things that I was trying to avoid for labor and delivery, I successfully avoided only to have them all happen afterwards.
In the postpartum.
In the
Yeah.
postpartum area, like all the Foley, a bunch of IV drugs, needed a blood transfusion, a bunch of pain meds. But after she was out, I was in so much pain with them getting out the clots and the hematoma. I was like, yes, everything you have, I guess, just throw it at me.
Yeah, this pain
Yeah.
is not the same. It's not. There's no
I think
purpose.
the difference is like in the postpartum, like that's not a purposeful pain like that. It's happening a little bit for a reason because it's like saving your life, but it's not like labor contractions are like they're purposeful and they're also a slow build, peak, and let go
to like bring your baby out. You can reason it, but like when they're reaching their hand up there to pull out some clots, there's no 10-second contraction. Yeah, there's no build up
No.
or like tiny bit of a peak
No.
and then like let it out. Like it's just their hand in your vagina pulling clots out. So like you're like at that point, this is no longer purposeful. Give me all the drugs. Like,
Yeah,
please, I'll accept.
that was so much worse than anything. Like, people ask me now, like, "Oh, will you, do you think you'll do Unmedicated again?" I'm like, "Oh, yeah, that was nothing in comparison to the, like, pulling out clots."
Postpartum.
It's
Yeah.
nothing. But yeah, so that was a very big 180 because I just had this, amazing experience. I was so proud of myself, and then all of a sudden it was like, "Oh, this is all coming crashing down on me."
Yeah.
So yeah, it was a very tough several hours and immediately after. But I just tried to get everything off and out as quick as I could. They were like, "Oh, do you want to disconnect this?" I was like, "Yes." Like, let's just disconnect. I was getting so uncomfortable with all of like carrying around the IV pole and then the Foley. I mean, so uncomfortable with everything. I was like, I went into this wanting to be able to move freely, and now I am so restricted. Uh, like it was a very big 180 in my expectations of what, especially the immediate postpartum was supposed to look like. So, yeah.
I think it's hard to prepare for what the postpartum will be like because there's like this huge emotional, like hormonal shift that happens. And then, like, we can prepare obviously as much as we possibly can for like what to expect, but no one can prepare to like expect a postpartum hemorrhage. It kind of just happens, especially for first babies. Like, you don't expect to like pass out on your way to the bathroom. Like, you're like, that's not going to happen to me. I'm not going to develop a 11-centimeter hematoma.
No, never.
Like, why do I need to prepare for that mentally? Because again, it's not super common. But then when it does happen to you, like you were at such a high having your baby, you're like, oh, I'm amazing, to then just like suddenly drop to be like, what the hell is happening?
Yeah.
So how did that affect like your postpartum journey, like once you got home and like settled in a little bit?
It definitely affected it. I think and you know what? One of the things I do want to mention is I'm so thankful for all of your guys' podcasts and birth stories because I mean, it is a little crazy that I think I listened to every single one of them, but I did know like postpartum hemorrhage is something that can happen. Like it is something that can happen. I knew like the medications they were going to possibly offer me, just all these things from preparing myself the way I did and from listening to all the different types of stories you guys have. So, thank you. Because if I hadn't listened to podcasts or seen so many different stories, I would have been in a lot worse shape. Just very confused. So, anyways, yeah, it definitely did impact me. I think just having all those things on me and from losing so much blood, it did take a lot longer for my milk to come in. So it was just, I mean, I prepped for postpartum in the sense that like I had meals in the freezer. And, I had ice packs at home and, pads and things like that. But nothing prepared me for the emotional shift. I think also from losing all that blood, being on a bunch of medications. My milk wasn't coming in. She was cluster feeding. Like, I mean, no, obviously I'd never experienced that, but even talking to other moms, they're like, oh, yeah, that's not very normal. Cluster feeding continuously, not just like overnight. Like, I mean, there was a solid 48 hours where she was trying to eat every 15 to 20 minutes. So I was already nervous about breastfeeding, and then it started not going well. I had blisters on my nipples. She's trying to feed. I was, for whatever reason, so scared about supplementing with formula. I thought, the moment we supplement, she's never going to be able to breastfeed, which is incorrect. And for whatever reason, I just had that in my head. Nothing prepared me for like the emotional toll of not being able to do something or seemingly not being able to do something that my body was supposed to be doing. Like I just thought like, oh yeah, you breastfeed it. It just works. And no, it was a lot harder. She ended up having a class 4 tongue and lip tie that we had to get
Oh, no.
revised, and she wasn't eating properly. And so there were just a lot of issues at the beginning with her feeding. My sister-in-law got married when I was 2 weeks postpartum, and so we traveled to Florida for that wedding, and that was, it was really hard. I would definitely maybe not recommend traveling at the 2-week mark. But obviously I'm so happy that we went. It's my sister-in-law and I love her and wouldn't have traded it for the world. But I mean, wow, it was just a lot going on at once. And so the people say baby blues are supposed to be like 2 weeks. I think it was like 4 weeks for me. Really not sure. I mean, I'm an emotional person, but I mean, I didn't go 24 hours without crying until at least 4 weeks afterward. I think I even celebrated my first 24 hours without crying with like a glass of wine.
As you
Treat
cried.
That's how
yourself.
excited I was.
Yeah.
Yes. I was like, oh, I went a full day with no tears. Um, but I mean, it was really hard, like just some postpartum anxiety. I started every sentence for the first several months with like, I'm scared or I'm worried. And it was really unhealthy. And it was mainly surrounding her sleep and like wanting her to be on this schedule and not introduce these crutches, but then realizing that she's going to sleep better with these so-called crutches. And I mean, I wish I could go back to those first couple months and just like give that girl a hug. Like, it's going to be okay. Like, calm down. But I started seeing a postpartum therapist, which was a really good decision just to have somebody to talk these things through with and say, just kind of look at me and be like, well, is that right? Is that a rational thought? And be able to look at myself and say, actually, no, like that's not rational. Like the thoughts that I'm having in my head, while they're valid, they're not always rational. You never, the postpartum anxiety hit me pretty hard and started, kind of sending me into this spiral of doubt and worry about just like every single little thing when I really just needed to be enjoying my baby. um but yeah, the postpartum period was really hard. I'm happy to say that we're doing a lot better now. She turned 4 months yesterday. Doing a lot better now. But yeah, it was really tough. The hematoma hung out for a while too, which made things very uncomfortable. It finally shrunk. And my appointment in the middle of July, they told me it was about 3 by 3 centimeters. So it was just really painful to sit. I mean, I couldn't sit down without being uncomfortable for several months. And when you're already trying to deal with, breastfeeding's uncomfortable and I can't even sit comfortably. It was a lot. A lot of stuff that I
Sounds
didn't.
like a lot.
It was a lot. A lot that I just didn't like. I didn't know how to prepare for that, and nothing can prepare for that. Prepare you for that. It's just, you just have to go through it.
And seek resources out as well. Like, you don't have to go through it alone, which I think
Definitely.
is something that like we can really highlight from your story, from pregnancy through your birth to the postpartum. Like, there are resources and people available to help support you throughout this entire journey. And sometimes it's just trying to find that person that is the best fit for you, but it's not something that we have to necessarily like suffer through alone.
By ourselves. Exactly.
Which sometimes I feel like in the postpartum, it feels like that's what you're supposed to do. Like, I should be able to do this. Like, I'm an independent woman and all that kind of
like,
stuff.
I'm a mom now. I'm supposed to suffer
Yes.
through, but it's not.
But yeah, I think it's important to also know like when to get the help that you need.
So baby blues does last up to 4 to 5 weeks for some people. So like you were totally within that normal people. A lot of people believe like after 2 weeks, they're like, I should be fine now. Like 2
I'm
weeks,
totally healed.
I'm good. This is abnormal if it persists past that. But no, most people, it's like a month, like 4 to 5 weeks. And then if it persists past that, that's definitely when we should seek help. But it should always like slowly kind of be improving. If it's like worsening, then that's also a sign to about like
I feel like
seek help.
if it's impacting your daily life or your ability to function, that would be like a reason to seek help earlier too. Like, you don't have to wait till 4 to 5 weeks to seek help. Like, so do you have any advice for someone who may be going through similar situations as you at various stages throughout your pregnancy, your birth, postpartum? I know there was a lot that happened. There's a lot that happens in this very
You can
short
have more
period
than
of
one
time.
word of it.
But what advice would you give to somebody who found out that they suddenly needed an induction and they were planning to have a low intervention birth, or they had complications postpartum, and they're like, what do you mean I'm having issues postpartum? Like, everything's I prepared, like, it's supposed to be perfect. Like, what advice would you give to, like, yourself? If you can go back to Alyssa 4 months ago, like, what advice would you give yourself?
Um, honestly, I would just tell her to breathe. Um, especially with the induction, I was so sad. I mean, when they told me that they recommend induction and we decided to stay, I mean, I was texting my doula and couldn't see the screen because I was just weeping. I was so upset. Um, and that obviously doesn't help the situation. And so I don't know if I could go back or provide advice, it would just be you can still have an amazing birth with an induction. Like, it doesn't have to be this scary thing where you're trying to, you know, I don't know, avoid it at all costs. Like, it can still be a really amazing thing. You can still go unmedicated if you want. I don't know how much harder or not it is because that's all I got. But, you can still go unmedicated. It can still be a really wonderful experience. I mean, my hospital was pretty good at, besides those monitors, respecting okay, I want to keep the lights down. I want to, do X, Y, and Z. And they were okay with that. So just kind of speaking up for yourself, and you can still have an amazing birth with an induction for sure. Even though it is a little scary. So advice is that it's not as scary as you think. And then postpartum, I mean, exactly what you said. Oh, I prepared for this. This shouldn't be happening, but it does. I mean, it happens, and just to kind of expect the unexpected of postpartum. I mean, you never really know what's going to happen, and just to reach out to, like you said, reach out to your resources. I've always seen things that say, "Oh, motherhood takes a village," and I never really got it until I gave birth and had all of these complications, and postpartum was so hard on me. Reaching out to people and having people reach out to me, even just friends and moms being like, "Are you okay?" Or "How are you really doing?" Don't tell me, "Yeah, everything's great." Tell me how you're really feeling. So just having resources that you can be your genuine self with, I think is so important. And just to know it's going to get better. I mean, I remember the first couple weeks just crying and crying because I'm like, what have I done? This is so hard. I don't feel like I know what I'm doing. I thought I was supposed to just know these maternal instincts. And you don't always know, but you're going to figure it out. And I think that's what I would tell myself. You might not know now, but you will.
Yeah. No, I love those words of wisdom.
Well, thank you so much, Alyssa, for coming on the podcast and sharing your birth story and for choosing us to support you throughout your pregnancy. It was really wonderful getting to know you throughout your pregnancy, bring you seaweed soup postpartum, and then to continue to support you after birth as well.
Yes, thank you.
So thank you again for coming on the podcast.
Of course.
When I was about a month postpartum with my second baby, I decided to start MamasteFit's 16-week postpartum return to fitness program, and I so enjoyed it. This program is so thoughtfully designed to rehab your pelvic floor and your abdominal core while also progressing towards regular workouts. I really struggle with pacing myself, and up until this point, I had never actually taken the time to learn how to properly engage my core and manage my intra-abdominal pressure, but this program did it for me. And they also offered gentle, frequent reminders of how important this postpartum period was to properly rehab and give yourself patience as you resume regular activities. And by the end of the 16 weeks, I was so happy with how I was feeling. I was already lifting as much as I had been prior to my delivery with no pain and no symptoms.
Thank you so much for listening to this birth story. If you want more support throughout your pregnancy, check out our online prenatal fitness programs and online childbirth education course. Our online prenatal fitness programs are offered in two main formats. We have our app-based program, which is going to be a list of exercise with short demo videos. This is a great option if you like to work out self-paced, you want to work out with a barbell, or you like to work out in a gym setting. But if you prefer to follow a video as you work out at the same time, we do have our prenatal on-demand program, a prenatal yoga program, and a birth prep on-demand program. So lots of different options depending on what you're looking for. And this is going to be a full-length workout video that you follow and work out with at the same time.
And if you're looking for a childbirth education course to help prepare you for birth and labor, check out our online childbirth education course. That is 9+ hours of education to include understanding the science of labor and birth, to take away that mystery to make it less scary, as well as discussing different birth options and different birth interventions that may be introduced to you during your labor process. By understanding what your options are, it helps you decide which ones you would actually be open to and which ones maybe you're not open to. And you can bundle our childbirth education course with any of our fitness programs to save an additional 15%. And for listening to this entire episode, you can use code STORY10 to get 10% off additionally off any of our bundles and any of our other education courses and fitness programs.